here's something most doctors never tell their patients. Insulin resistance is the root cause of type 2 diabetes, not just high blood sugars, not carbs, and unless you address insulin resistance directly, you'll stay stuck in the cycle of medications, yo-yo diets, and rising A1C. In this video, I'm going to explain what insulin resistance really is, why most doctors don't emphasize it, and most importantly, how you can actually reverse it backed by science. Let's start with the basics. Insulin is the hormone that acts like a key, and its job is to unlock your cells to receive glucose, the sugar from your food, so it can enter your cells and be used for energy. So glucose isn't necessarily a bad thing. It's bad when it's stuck in your blood, but it's not bad when it's actually in your cells and that it's used for energy. But when you have insulin resistance, that key doesn't work anymore, or it doesn't work as well. So the locks on your cells get rusty. So glucose is stuck in your blood, and your pancreas have to pump out more and more insulin just to get the job done. And over time, this leads to high insulin, high blood sugar, and eventually type 2 diabetes. Now, here's the part most people never hear. Why don't doctors talk about insulin resistance? The truth is, our medical system is designed to manage medical symptoms and not to fix the root cause. Doctors are trained to lower blood sugar with medications or by telling you to cut carbs, but that doesn't actually restore your cell's ability to use insulin properly. And here's the kicker. You can have insulin resistance for years before your blood sugar even goes up. Research shows that elevated insulin often appears 5 to 10 years before diabetes diagnosis, but standard blood tests don't actually check insulin, only glucose, so the root cause gets unnoticed until it's too late. So what actually causes insulin resistance? It's not just sugar. The biggest driver is actually too much fat, especially saturated fat, and they are stored in muscle and liver cells. When excess fat builds up in these tissues, it's called lipotoxicity. It literally blocks insulin's ability to do its job. There's a study that found that when people actually reduce the toxic fat in their lifestyle, in their diet, it actually helped them dramatically improve insulin sensitivity, and many of them were able to reverse their diabetes. And there's plenty of studies confirming that lowering saturated fat intake and increasing fiber can restore insulin action at a cellular level. So how do you reverse insulin resistance? Research shows that you should lower saturated fat intake, especially found in red meats, processed meats, butter, or ultra-processed foods. This decrease fat buildup in your muscle and in your liver cells. Number 2, increase fiber. Get more from beans, lentils, whole grains, fruits, and vegetables. Fiber slows glucose absorption, feed your microbiome, and improve insulin sensitivity. Number 3 is having daily movement. Even a 20-30 minute walk, especially after meals, can help shuttle glucose into your muscles without needing as much insulin. Number 4 is having sleep and stress management. Chronic stress hormones like cortisol make insulin resistance worse, whereas good sleep and stress reduction directly improve insulin function. Now, all of these is not about perfection, but it's about building those daily habits that consistently improve your insulin sensitivity. And in many studies, it's been shown that people with type 2 diabetes can restore normal glucose numbers and get off medications when they focus on improving their insulin sensitivity. So what doctors don't tell you about insulin resistance is you don't have to settle managing diabetes forever. You can address the root cause and reverse it. If you want to learn exactly how to do this step by step, I made a free reversing diabetes training for you. Link is in the description below, and I'll see you guys there.